So allodynia is when a non-noxious stimulus creates a noxious or painful result.
Can you just say that again? Because I think that's profound. And raise your hand in the audience if you found that to be profound, just that understanding, which is why we do a touch and tell on the day one.
Yeah.
Why your palpation for your table talk is important. So if I can just have you kind of do like a double click on the allodynia, just explain the noxious and non-noxious stimulus.
Sure. So nociception is the detection and transmission of information related to tissue damage or tissue stress or tissue inflammation, right? It's just it's a chemical depolarization of a receptor, and then that message travels in the nociceptive pathway in the spinal inflammatory tract. It's not pain. There's no pain anywhere. It may reach the part of the cortex that you could perceive it as pain, but it may not. In fact, it usually doesn't. Okay? So that's nociception, and that's pain, the emotion. Allodynia is when you've had chronic inflammation, usually from in a joint, it's going to be from lack of movement, scar tissue adhesions. Then you start to get the prostaglandins and the inflammatory response, because your body recognizes lack of motion as it requires an immune response. It's actually literally, it's pathogenic. It's like, that's not normal. We got to get in there. So whether that's lack of movement because you hurt it, or whether it's lack of movement because you just don't exercise at all, you sit all day, that's recognized from your body as a threat.
I love that additional layer you just put on that. That's huge. It's a threat to the body. Lack of movement is also a threat.
Because
that speaks volumes.
It results always in scar tissue adhesions within a few hours. You can take an Olympic athlete, and if you put them in bed rest for one day, you can actually measure the changes in their blood sugar levels, their insulin response, their inflammatory response. All of it is changed within 1 day of bed rest. Lack of movement. It's incredible how, so you take out movement from a human being, and they literally shift hard.
I jumped in too soon. Finish that definition of allodynia.
Okay, so allodynia is when you have underlying inflammation, which results in a non-noxious stimulus like touch or movement, causing a noxious response like pain or tenderness. And so it's not painful when you're sitting here, but if I come and touch it, the tooth's not painful till I put cold or hot on it. It's because there's underlying inflammation and degeneration occurring, which makes that nociceptive system sensitized, meaning you need less stimulus to depolarize and fire that pathway, sensitized. And so that is a absolute valid, scientifically validated indicator of underlying inflammation. And that's what a subluxation is. Subluxation is an inflamed joint that's not moving.
I love it. I think that's going to be huge for the listeners too, just to differentiate that and understand that when you palpate, you go hands on and all of a sudden it hurts and they didn't feel it. Just knowing that that's allodynia and just going, hey, listen, this is a problem that has been going on.
100%.
And this idea that it's about to get worse, there's so much in dentistry that translates to chiropractic. When they put cold water and they go, oh, I'm going through the roof, they go, okay, well, that tooth has been dying. Usually what they'll say is it's in its final days. Yeah. Like it's a near death right now. And it's the same thing with the subluxation. You put pressure on it, all of a sudden it sends somebody through the roof. That isn't the first time they felt it. It's been going on for a while. So the non-noxious stimulus could be palpation. The noxious stimulus is extreme pain. That just means it's been chronic. There's been inflammation going